Greetings and welcome to the UNFPA Asia Pacific commemoration of World Population Day 2021, the most important day in the UNFPA calendar. I'm Leila Joudan, the UNFPA representative to the Philippines, joining you live from Manila. We appreciate our audience from across Asia and the Pacific and globally, joining us on this special occasion. For the second year in a row, World Population Day is marked amid the COVID-19 pandemic. Last year, we forecast a range of impacts the pandemic would likely have on sexual and reproductive health and rights of women, girls, and young people. This year, we look back at the year that was from the perspective of three very different countries, the Philippines, Nepal, and Thailand, offering us a range of views on different but interlinked issues. But first, we turn to our UNFPA Regional Director for Asia and the Pacific, Björn Andersson, to set the foundation for our narrative. Björn, the floor is yours.
Thank you so much, Leila, and a warm welcome to all of you joining us today. For the second year in a row, we mark World Population Day amid the ongoing COVID-19 pandemic that continues to impact Asia Pacific and the entire world. At the very outset of the crisis, UNFPA warned of severe consequences to the sexual and reproductive health and reproductive rights of millions of people, especially women and girls. Our analysis indicated several areas where COVID-19 impacts would contribute directly to the deterioration of care and services for women and girls. We projected the impact of COVID-19 on key health services in 14 high-burden priority countries in Asia Pacific. In particular, the impact on deliveries carried out in facilities with a skilled birth attendant, but also on access to family planning services. Our modeled estimates predicted a 20% reduction in the overall uptake of services in the best case scenario, and a reduction of up to 50% in the worst case scenario. In 2020 alone, as maternity health resources were being diverted or diluted, our projections in the 14 countries studied showed that the maternal mortality rate could increase by 17% in the best case scenario and by 43% in the worst case scenario. And it would take at least 4 years to recover from this drop. Even before COVID-19, there was an estimated 140 million women in Asia Pacific with an unmet need for family planning. Our projections showed that unmet need triggered by severe disruptions to contraceptive supply chains and services could spike in the first year of the pandemic, increasing by 21% in the best case scenario and 40% in the worst case scenario. Further, the effects of these disruptions would last significantly longer and not recover until 2030. We also forecast a sharp spike in gender-based violence amid pandemic lockdowns, along with an increase in harmful practices against women and girls like child marriage. This prediction has also sadly come true based on available data, both quantitative and qualitative. Faced with these daunting challenges, UNFPA, the UN Sexual and Reproductive Health Agency, mobilized to take swift action. We worked with 22 countries on emergency plans to ensure the provision of essential maternal health services. Related to this, we encourage countries to find ways to better integrate sexual and reproductive health services with gender-based violence, prevention and response services, given the limited resources available and funds being diverted from standalone programs. We developed guidance from midwives and health workers on providing selected pre- and post-birth advice to pregnant women using mobile or smartphone applications to ensure continuity of care. UNFPA worked with manufacturers and governments to help get contraceptive supplies chains and procurement systems back on track. Through our global UNFPA supplies program, we advocated with several governments to significantly increase budgetary allocations for family planning programs and commodities. In some countries, we supported efforts to reach remote communities through expanding telemedicine services to incorporate family planning and by integrating immunization services with family planning programs. Given the overwhelming demand for technical support on gender-based violence and COVID-19, we quickly adopted a range of existing guidance, particularly on gender-based violence in emergencies. Maternal mortality, unmet need for family planning, and gender-based violence are not new challenges. Asia and the Pacific had been making significant advances in addressing them prior to the pandemic. It is crucial that we do all we can to restore the progress we achieved. This is essential as the deterioration in provision of support has direct and immediate negative consequences for women and girls across the Asia-Pacific region. Given the limited time remaining, this also causes the world to be more challenged to achieve the 2030 Agenda for Sustainable Development and its Sustainable Development Goals. It is important to note that COVID-19 impacts are not necessarily similar across all countries. In some countries, there are fears of an escalation in unintended pregnancies and unchecked fertility. In others, there are concerns that already low fertility rates could plunge further as couples continue to delay childbearing. Demographic changes are likely to be diverse across countries, as the pandemic has a significant impact on sexual and reproductive health and behavior. But overall, there is enormous uncertainty over how the pandemic will affect births, with data gaps preventing us from knowing in many countries what changes have occurred or will be occurring. These concerns and fears may prompt governments to push for women to have fewer children, or the reverse, to push pronatalist policies. But these approaches are simply not advisable. Instead, UNFPA calls for all governments and leaders to respond to the population development and demographic challenges of COVID-19 by prioritizing the sexual and reproductive health and rights of all people. Of course, each country must craft responses to address their unique and specific dynamics. We have a diversity of demographic and other realities across the Asia-Pacific region, and each country must tailor its response both by using effective tools currently available and innovating new approaches. Still, however, there are certain principles that all countries should maintain, principles contained in the landmark program of action that emerged at the 1994 International Conference on Population and Development in Cairo, or ICPD. That's where 179 governments agreed that sexual and reproductive health and reproductive rights, with a particular focus on women and girls, must lie at the heart of development. The program of action, so integral to the success of the SDGs, provides a clear path forward. A path grounded in gender equality and human rights, tied to rights and choices for all. A path that ensures investments in girls through childhood and adolescence and on to adulthood, ensuring optimal opportunities for health, education, and decent employment. A path that ensures that every person has the freedom to shape their lives the way they choose, empowered with sexual and reproductive health information and services they need, including rights-based and voluntary family planning under universal health coverage. A path paved with human rights and welfare of all, and especially women and girls. UNFPA's mandate, guided by the ICPD Program of Action, is to enable reproductive rights and choices everywhere. This remains critical to the success of all people, no matter who they are or the socioeconomic and demographic realities they live in. As such, going forward, UNFPA encourages governments to invest in social services, including in sexual and reproductive health and rights, ensure that women, men, and young people have access and choices to sexual and reproductive health services, address gender-based violence, including its root causes found in toxic masculinities, and ensure services to GBV survivors. It's only through a holistic approach, increased resources, and joint efforts between governments, civil society, and other partners that we can address harmful norms and values in societies. On World Population Day 2021, UNFPA in the Asia and Pacific region pledges to work with all countries and stakeholders in building back better from the COVID-19 crisis now, and thereby laying a stronger foundation for our collective future. Thank you so much, and back to you, Leila.
Thank you so much, Björn, for setting the stage for us. Let us now turn to the Philippines, the country I have the privilege of serving in as UNFPA representative. Even before COVID-19, the country had tackled significant challenges in strengthening sexual and reproductive health and reproductive rights, including expanding access to contraceptives and other family planning supplies and services. To get the full story, we turn to the Philippines Population Commission and other key partners to produce a specially curated segment for World Population Day, featuring the stories and experiences of real people and the steps taken by government and civil society to support rights and choices for all at this time of crisis. We begin with a brief video that provides the context. So let's watch together this video.
For many women seeking to plan their pregnancies, this posed a challenge: how to access critical information, services, and supplies. But government agencies, in collaboration with UNFPA Philippines, swung into action, boosting and publicizing the range of sexual and reproductive health information available online through rh-care.info, family planning pages, maternal health content, a section for young people, and even resources on how to prevent and respond to escalating gender-based violence amid the pandemic. Beyond key online content, the site allowed users to chat in real time with counselors and service providers. The Philippines Commission on Population and Development also established its helplines dubbed Usap Tayo sa family planning nationwide.
rh-care.info helped me by providing information regarding the different contraceptives available, as well as the different providers and their contact details. Through the website, as well as their Facebook page, I was able to ask questions and gain information that I needed. And because of that, I was able to get the health care that I was looking for.
Now we turn to a more in-depth discussion with the Population Commission and Human Rights Commission, moderated by YPEER, our UNFPA Youth Civil Society partner.
Hello everyone! Welcome to the Philippine segment of the World Population Day. I'm Edgar Luquiao Jr., your host this afternoon from Imperial Officer, a proud member of YP Pilipinas. And it is an honor for me to share some of the real stories of young people during the pandemic, as what you saw is just a teaser for these segments. As we all know, this is the second year that the World Population Day is marked amid the COVID-19 pandemic, a global crisis that continues to affect many of us wherever we are in the world. And so, we are celebrating this day to reiterate that sexual and reproductive health rights and choices remain critical, especially for women and young people in the Philippines and to the whole Asia-Pacific region. Without further ado, let us now listen to the stories of these young people.
Beginning at age 11, I had ignorantly tolerated the pains of irregular periods, which I experienced only 5 to 6 times a year and led to heavy blood loss. I took pills to regulate my period, which wasn't easily bought since I was told I needed a prescription, and some passers-by and cashiers at the drugstore gave me cynical looks. Due to the shame, I never bought them again unless prescribed. When I was sexually active, we used condoms to be safe. Again, we were looked at dismissively, and even friends unconsciously berated us for wearing condoms. Last month, I was rushed to the hospital and diagnosed with PCOS. The cost of medication and hospital fees for my sake became overwhelming for my family. Throughout my life, I've experienced challenges with regards to my reproductive and sexual health. The years of unstable hormones, medications, and the social stigmas had an overwhelming effect on my body and my mental health. I had the pains of experiencing judgment for something beyond my control.
Mahirap magbuntis at manganak. Pero salamat sa Diyos at ligtas kami ng anak ko. Nakakatakot kung iisipin ko lang. Mabuti na lamang po. Ang mensahe ko naman sa mga kabataang tulad ko, ugaliin natin na maging bukas ang komunikasyon sa ating magulang at kapatid. Huwag tayong padalos-dalos ng desisyon. Lagi tayong makinig sa payo ng nakakatanda sa atin. Mahirap ang buhay teenage mom. Imbis na nag-e-enjoy pa sana tayo ngayon, pero hindi na natin magawa.
Wow, those are actually powerful and inspiring stories from our young people, and we admire your boldness and courage for what you've been through. And this afternoon, we also have two important guests who will share their insights on the stories of these young women. First, we have Dr. Juan Antonio Perez, the Executive Director of the Philippine Commission on Population. He is a medical doctor and a public servant with over 33 years of experience in both public and private health programs in the Philippines. He is a key person in the implementation of the Responsible Parenthood and Reproductive Health Law in the country and heads the secretariat of its national implementation team, concurrently serving as its vice chairperson. We are also fortunate to have with us Commissioner Karen Gomez-Dumpit of the Commission on Human Rights. Commissioner Karen Gomez-Dumpit has served the Philippine government for the past 30 years, 27 years of which has been devoted to human rights advocacy, including 9 years as the first director of the Commission on Human Rights Child Rights Center. Commissioner Karen is also the focal commissioner for gender equality, women's rights, and LGBTQ plus rights. Good afternoon, Yusek GP and Commissioner Karen.
Good afternoon.
Magandang hapon.
Well, first of all, before we start our highlight questions for this segment, can we get some insights or initial quick reactions from the speakers on the videos that we have seen? Let's start with Yusek Juan Antonio Perez.
The story particularly of the first girl who experienced a kind of stigma because of her reproductive health needs. This is something that has been happening even before COVID, no? And that shows that the roots of our problems here, ensuring sexual reproductive rights and health of girls and women, is a long-standing issue. And the story of Valerie from Columbio, Sultan Kudarat, just highlights for us how more difficult it has become in the period of the pandemic. And that her experience of having a child at 16 years old, and then having to start a family and leave school. This is what's happening to around 166,000 minors in this country who have families too early, who have families when they are still minors, still in school. And that is the essence of the new order that has been issued, Executive Order 141. It is to address those issues that have happened to girls 11 years old with PCOS and to mothers at 16 like Valerie. We are going to address the root causes of teen pregnancy in this country. And it will take probably so many agencies who are working in education, health, and other sectors. And we plan to come out with a framework for this. The Commission on Population and Development has been asked to do this in 60 days. So I believe even as we maintain services today for women, girls like Valerie, we hope that the newfound plans will also address, whatever plans we come up, will address the root causes. And so that we will see less of Valeries in this country. So that's what we're working for now.
Thank you so much, Yusek. And maybe also hear the reaction of Commissioner Karen.
Thank you for the opportunity. Of course, the CHR is your gender ombud under the Magna Carta of Women, and we've heard two stories of very young girls when it comes to trying to access their reproductive health services in government. The first example just shows you how stigmatized the experience of a young woman trying to access a commodity, which is really the pills, no? And the reaction and the very judgmental reaction of people when they try to avail of this particular commodity. On the other hand, you find also a very young girl who happens to have been, who has experienced teenage pregnancy. Of course, she also relates the experience that she has had with local government units that have been responsible in giving RH services to her, and she's been very thankful for that. She was also thankful for the family who has supported her despite, as what she said, wrong decisions on her part. But she wants to move on and she wants to continue studying. She also wants that for her child. So in a way, we get to see a glimpse of how young women do experience accessing reproductive health services in the country.
Thank you very much, Commissioner Karen. And we'd also like to ask a brief answer from our speakers on these questions. First, we have Yusek Chipi. How did the Philippine government, the Commission on Population in particular, respond to the sexual and reproductive health needs of women and young people in the country, particularly during the pandemic?
As early as the first week of April 2020, we already issued guidelines to our regional offices for the delivery of family planning commodities direct to the homes of those who needed the benefit. There are 2 million women using family planning pills in this country, contraceptive pills. And because of the lockdowns, they were in danger of not getting those services because they would not be able to go out because of the quarantine, or the health services would be concerned with other work. So that was a quick move that we did, and DOH also did the same, asking all barangay health workers to do the same. So we have shifted the work in family planning and RH services to the community level, so that the health facilities, if they're unable to deliver the services, they have this alternative. We've also opened other channels of communication, the internet. We have We have Usap Tayo sa Family Planning hashtag as a way to reach our helplines, telephone lines, Facebook access for people who need to know where family planning services are, how to address the needs of young people in terms of their sexuality, and also information on gender-based violence, which we feared with the Commission on Human Rights would be increasing in this period. So we tried to address those three major concerns, and we have shifted to virtual online classes for pre-marriage and other advocacies of the Commission. And it has borne fruit. We have expanded family planning during the period of pandemic, and we're very thankful to our local government units and volunteers for continuing to expand family planning and RH in the country even with the pandemic.
Well, thank you, Yusek. And I'd like to highlight the effort on delivering these necessary services straight through in the grassroots and reinforcing the doors and platforms of the Commission in addressing these issues. Thank you very much, Yusek. Let's also hear Commissioner Karen and learn what she has to say on the role of the Commission on Human Rights in responding to the sexual and reproductive health needs in the country. Commissioner Karen.
Thank you very much for that question. Of course, we don't look too far. We have our constitutional mandates and our statutory mandates under the Magna Carta of Women, for instance, as well as, of course, in the Constitution, we do have our roles in promoting, protecting human rights, particularly of women and girls, and to be able to also promote sexual and reproductive health rights. No? Well, in the past, even prior to the pandemic, we have been doing this mainly through our regional offices located in all regions in the country. But we do have what we call the Office Gender Equality and Women's Human Rights Center. They have been in charge of leading the CHR in many mechanisms, no? Including, of course, interagency mechanisms that include, of course, a Population Commission, the Department of Interior and Local Government, Philippine Commission on Women. So in other words, we do cooperate with government using our role as an advisor to governments, particularly what was mentioned earlier by our good USEC from the Population Commission, that we have also advised government on how to better provide services during this pandemic. And that includes, of course, the provision of sexual and reproductive health commodities to be included in relief goods so that these commodities will reach the families and the individuals concerned and they can access their sexual and reproductive health rights. Very recently, of course, we all know that in a pandemic, rights are not on a lockdown. But we do know that the problems persist. It still continues, including gender-based violence. We did come up with an online reporting portal to allow all our constituents to be able to report on GBV cases. And that's what we call the e-report mo sa Gender Ombud, or in English, it's reported to the Gender Ombud. And what we do here is we're very proud of the fact that this actually allows for anonymity of reports so long as we do get leads on how we can respond to these cases. It also allows victims who are trying to survive their milieu or their problems by just relating their story and waiting for them if they want to be ready to actually pursue their complaints. So those are just one of the two things that we have been doing. And the last one perhaps is something that we ought to share as well, because we are advisor to government and we do call out the wrong practices and the practices that have been proven to be a barrier to young women and girls in particular in trying to access particular rights, including, of course, the general services, let's say, of RH, but also in terms of trying to access shelter facilities if they want to get out of an abusive situation. Because of the lockdown, they are not able to access it because most of our facilities, especially during the start of the pandemic and the measures to address them, were also closed at the time. So we were able to bridge these gaps in. So that's it. Thank you.
Right. I believe unity is the name of the game in addressing the issue of the young people, and we know that this connection between the agencies will break barriers brought about by the pandemic. And of course, the role of your commission is really commendable. For that, thank you so much, Commissioner Karen. Well, to USEC, GP, and Com, Karen, we really appreciate the efforts that you and your agencies are doing to address the issues of the young people. And we are also grateful for the time you spent with us for this year's World Population Day. I hope our viewers were able to learn or reflect from what we saw today. As for me, I learned that the access to ASRHR in this time of crisis reduces risks on our life, health, and well-being, especially those of vulnerable groups. It is important that we listen to what these young people are experiencing for us to be able to respond to their difficulties and challenges heightened by the global pandemic. But before we end this segment today, we would like to call our visual documenter to give us a creative summary of this session. Kuya Kiko, good afternoon. We're excited to hear your creative summary.
Thank you, Edgar. I am Kiko Miranda, and I am here to present the graphic synthesis of our session. Our session started with the sharing of the stories of two young girls. They talked about how social stigma from accessing contraceptives at a young age was a major barrier. One young girl shared that she had to undergo a lot of pains of experiencing judgment for something that was beyond her control. One young mother, Valerie, also shared to us her struggles as a young mother. She said that life is hard for teenage mothers and that despite her situation, she still dreams of finishing school. After the sharing of the stories of the two young girls, Yusek Perez from the Population Commission shared with us his insights on teenage pregnancy in the country. He mentioned that there are 166,000 minors who have families at a young age. Most of them have stopped schools and most of them experience being stigmatized by the community. Through an Executive Order 141, the government of the Philippines now prioritizes the implementation of measures addressing adolescent pregnancies in the country and mobilizes government agencies for the said purpose. On what Population Commission did as a response during the pandemic, Yusek Perez shared that they have done two things. First, they have shifted family planning and reproductive health services to the community level, and they have expanded their channels of communication to leverage on online and telecommunications. Our second speaker, Commissioner Karen Dumpit of the Commission on Human Rights, shared with us the role of the Commission on Human Rights in responding to sexual and reproductive health and needs in the Philippines during the pandemic. She shared three things. The CHR served as an advisor to government on how to better provide services during the pandemic. They also leveraged and mainstreamed their online reporting portal and have included SRH commodities and relief goods to be given to households. She ended by saying that in a pandemic, rights are not on a lockdown. That is why there is still a need to ensure that young women and girls still have access to sexual reproductive health services. The key message of the entire session focused on the sexual reproductive health and health rights and choices still remain critical, especially for women and children. There are three key takeaways from this session. One, there's a need to support and sustain responsive and accessible community-level healthcare. Second, two, nurture a meaningful relationship with family and friends. And lastly, there is a need to listen to the experiences of young people. So that is the synthesis of
Thank you, Kiko. Thank you, Kiko, USEC GP, Commissioner Karen, and Edgar. Now, far from the Philippines and Southeast Asia, COVID-19 has also hit Nepal and South Asia particularly hard, with rising case numbers in the past several months. Well before COVID-19, however, accessing family planning and other sexual and reproductive health services was a challenge for many women and couples in far-flung corners of this landlocked and mountainous country. Despite that, progress was being made in reaching those hardest to reach, as this special video from UNFPA Nepal demonstrates. So let's watch together this video. We can start with Bandana. I think that we have technical issues to see the videos. So if you allow me, we can perhaps start with our special guest from Kathmandu. So yeah, joining us from Kathmandu to discuss these issues is someone who had made it her life's calling to empower women, not only in Nepal, but globally. So Bandana Rana is a member of the UN CEDAW committee championing the Convention of the Elimination of All Forms of Discrimination Against Women. She is also a member of UNFPA's High-Level Commission on ICPD 25, the chair of the Global Network of Women Peace Builders, and the co-founder of the Nepali NGO Sati. Bandana, welcome.
Thank you, Leila. It's lovely and honored to be a part of this event.
Thank you, Bandana, to be with us today. So perhaps we can start with an important point that is now the impact of the COVID-19. No, as we know, over the past 18 months, the impact of COVID-19 in Nepal has been on many fronts severe. What are the lessons we have learned from this, Bandana?
Thank you, Leila. First of all, thank you so much. And I really hope that the video from Nepal can be shown soon. It's a positive story of progress and achievement of women in making their choices and their rights. So we can talk about that as well. But in the meantime, you have asked me about the impact of COVID-19 and the lessons learned, particularly being an activist and being associated with the NGO Sati, which also operates 4 women's shelters and 5 children's shelters. Just to share you the experience during the first lockdown, as everyone globally, we were very unprepared, particularly in terms of operating the shelters effectively. We had residents in the shelters, women victims in the shelters, some of them who were pregnant, some of them who had infants, and we lacked the capacity and the adequate infrastructure to respond to the pandemic effectively in terms of providing effective services to the rising violence, the numerous calls that we were getting from victims, in terms of reaching out to them as well. So that was a huge, challenge. Particularly, I recall there were many challenges, in terms of whether we had adequate quarantine space, whether we could ensure the safety of new entrants into the shelter, whether we could actually address the concerns of the women who are already in the shelters. And one of the critical concerns that relates to access to reproductive health and services were that women in our shelters, as I said, some of them pregnant, some of them with just born babies, needed to access medical services. And that is where we were under strict lockdown, and we had, shelter services was not listed under essential services during emergencies. And even till today, I am lobbying, along with our networks, of course, to include shelter services, to include sexual and reproductive health services under essential services, and that we get the, the license, the ability to move and take the women residing in our shelters to access medical services. That was a huge challenge, that was one of the challenges that we faced as an organization working in this area. But looking at the broader challenges, of course, there were many media reports which also showed that sexual and gender-based violence, complication in reporting and seeking help, online harassment and abuse cases drastically increased in this pandemic, deepening inequalities. And among the essential health services, the most affected was reproductive health. With the increase in number of COVID cases, many public hospitals were converted to COVID hospitals, which further limited the reproductive health services. Women could not access those services. There were no health posts. There were small health posts for non-COVID cases, which were not well equipped to cater to the complex sexual and reproductive health issues. In spite of the most progressive legislation on reproductive rights in Nepal, it has one of the highest rates of maternal deaths in Asia today. According to the Department of Health Services, there was an almost 200% rise in maternal mortality rate during the lockdown. The availability and distribution of contraceptives and other maternal health medicines were also hampered. There are now more chances of unwanted pregnancies, unsafe abortions, physical and sexual violence, and psychological stress and depression because of confinement, economic issues, limited decision-making power, and reduced access to the healthcare facilities. COVID-19 has had a devastating impact on women's and girls' health. We must join forces to work collectively to ensure adequate financial and human resources to safeguard the lives of the most vulnerable women and girls and pave the way forward to realizing the collective vision of ICPD of rights and choices for women and girls in Nepal and also globally. Over to you, Leila.
Thank you so much, Vandana. So now the video, I think, is ready. And as you said, Vandana, the video is really powerful. So let's watch it together.
अब मेरो विचारमा त अब नेपाल गरिब नै छ गाउँघरको त्यस्तै त अनि चलन काम गर्ने अनि बिहानै उठेर अनि चुलो चौको पानी बोक्ने दाउरा बोक्ने घाँस काट्ने अनि सबै काम गर्नुपर्छ नेपालको छोरीहरूलाई पढाउनु हुँदैन भन्ने चलन थियो पहिले अनि समथिङ हाम्रो पालादेखि नै अलि छोरीहरूलाई अलि राम्रो रूपले हेर्नुपर्छ भन्ने अलिअलि सुधार आइरहेछ मेरो नाम ममता नकाल खड्का म 23 वर्षको भएँ म 2वटा बच्चाको आमा हो पेशाले म एउटा शिक्षक हो मेरो घर सानीभेरी गाउँपालिका 3 खाराखाली रुकुम पश्चिम नेपाल उपयुक्त साधन केही पनि हुँदैन थियो अरे हामीलाई पुरा गर्नुहुन्छ क्या आमाहरूले धेरै पहिला त साधन नै थिएन जति सक्यो 8वटा 9वटा 10वटा बच्चा बच्ची जति हुन्छ त्यो जन्माइराख्ने अनि उपयुक्त साधन नभएपछि केही गरी बच्चा रह्यो भने अब त्यो बच्चा धेरै भयो भने बच्चा बनाउन चाहेन भने अब गरौँ भारीहरू बोकेर यो हाम्रो गाउँमा पाइने जडीबुटीहरू प्रयोग गरेर बच्चा गिर्छ अरे भन्ने सुन्ने अनि 15 वर्ष काट्यो भने छोरीहरूलाई विवाह गरिदिनुपर्छ अनि अर्काको घरमा जाने जात हो धेरै राख्नु हुँदैन छोरीहरूलाई घरमा भन्ने चलन छ नेपालमा अनि घरमा राख्यो भने अनि पछि छोरीको आइमा के छोरीको जात हो अनि राम्रो हुँदैन अनि नराम्रो दृष्टिकोणले हेर्छन् सबैले भन्ने अनि म सर स्कुलमा पढिराखेका थिएँ अनि उहाँले पनि स्कुलमा पढ्ने त्यसरी स्कुलमा आउने जाने बाटो पनि एउटै थियो अनि घर पनि नजिकै छ मैले 12 क्लासमा पढ्दै थिएँ अनि सबै साथीहरूले फर्म भर्दै थिए मेरो फर्म छुट्नै लाग्यो अनि हामीहरूको दुईजनाको लत अगाडि नै थियो अनि त्यसपछि बुवाले पैसा जुटाउन सक्नु भएन फर्म छुट्नै लाग्यो अनि त्यसपछि उहाँले प्रस्ताव पनि राखिरहनु भएको थियो विवाह गरौँ बुवाले सक्नु हुँदैन घरमा पनि त्यस्तै छैन त अलिकति घरको भन्दा अनि अब उहाँले पैसा दियो भने फेरि गाउँले कुरा काट्ने अनि यसले पैसा दियो पढायो भन्ने अब पहिले मेरो सपना त नर्स भन्ने थियो तर त्यो सपना पुरा हुन नसक्यो भने मेरो म वैवाहिक जीवनमा बाँधिन पुग्यो अनि मेरो 2वटा बच्चा बच्ची भयो मेरो पहिलो बच्चा पनि भयो अनि दोस्रो नानी जन्मियो अनि सन्तानको रहर पुग्यो मेरो सन्तानको रहर पुगिसकेपछि चिन्ता भयो क्या मलाई अब के साधन प्रयोग गर्ने होला अनि कसरी बच्चालाई 2वटा बच्चा मात्रै बनाउने अनि कुन निर्णय लिने होला भनेर सोचिरहेको थिएँ परिवार नियोजनको साधनहरू हाम्रो रुकुम जिल्लामा आधा जतिले पाउन सकेको छ आधा जतिले पाउन सकेको छैन किनकि विकासै भएको छैन अनि यो रोडहरू अनि हेल्थ पोस्टहरू नजिक छैन अनि जहाँ नजिक पर्ने आइमाईहरू बुझेको अलि बजारतिरको आइमाईहरूले राखेको छ तर गाउँतिरकोलाई त्यति थाहा छैन UNFPA र मेरिस्टोपले त्यहाँ आएर सिम्बी हेल्थ पोस्टमा आएर इम्प्लान्ट र राख्ने कार्यक्रम राखेको रहेछ अनि हाम्रो दिदीबहिनीहरू को जानुभएको थियो गएर राख्नु भएको रहेछ अनि त्यसपछि त्यो कुरा मैले सुने अनि म त्यसकै खोजीमा थिएँ अनि त्यो त्यस्तै मैले भने जस्तो पाएँ अनि म पनि इन्द्रा अगाडि राखेको साथी इन्द्रासँगै गएँ अनि त्यसपछि कुरा बुझेँ पहिले कस्तो हुन्छ के हुन्छ गाह्रो अनि पछि अप्ठ्यारो भने यस्तो हुन्छ अनि 5 वर्ष हो भनेर सबै कुरा बताउनु भयो अब 5 वर्षसम्म ढुक्क बच्चा नजन्माउने अनि बच्चा बच्चीको पालन पोषण गर्न सजिलो हुन्छ अनि म खुसी भएँ म राख्छु भने अनि श्रीमानलाई पनि सोधेको थिएँ श्रीमानले पनि राख भन्नुभयो अनि त्यसपछि इम्प्लान्ट राखेँ अनि घर फर्केँ अब बच्चा बच्ची मैले सन्तानको रहर पुगिसक्यो यसले फाइदा नै गर्छ जस्तो लागिरहेछ अब बच्चा बच्ची नबनाउने आफ्नो भविष्यतिर अब कसरी बच्चा बच्चीलाई हुर्काउने कसरी बच्चाको भविष्य उज्जवल बनाउने जस्तो कि अब मैले स्कुलमा पढाउन सक्छु इम्प्लान्ट राखेँ अनि राखिसकेपछि अब मजाले ढुक्क साथ मैले बच्चा बच्चीको स्याहार सुसार अनि लगेर पढाइमा पनि राम्रोसँग पढाउन सक्छु बच्चा बच्ची हुर्काउन सक्छु यो एउटा परिवार नियोजनको साधन भनेको एउटा सुन्दर भविष्यको एउटा साधन हो फ्यामिली प्लानिङले मलाई साथ दिन्छ जस्तो लागिरहेछ मेरो जुन बच्चा छ तिनीहरूको उज्जवल भविष्य हेर्न चाहन्छु सायद यसले सहयोग गर्छ जस्तो लागिरहेछ
Yeah. Bandana, the story we just saw demonstrates how important is to place value on the life health, and well-being of women in Nepal and beyond. But despite the progress that's being made, achieving genuine gender equality remains a challenge for so many and on so many fronts. And even, before the COVID-19 pandemic. So, Bandana, may I ask you to reflect on the video we just saw now and the wider issue it contains on rights and choices for women and girls? Over to you.
Thank you, Leila. Thank you. First of all, again, thank you for including Nepal's video in this segment. And as we have seen in the video, the 23-year-old Mamata is her name from Western Nepal. She represents many young women of today's Nepal. We see that, we can clearly see that when information reaches the most rural area, it enables women and girls, particularly if they are literate, to make their choice on their rights. It also signifies the gradual progress that is being made in Nepal in terms of awareness, education, and services, and many organizations, including UNFPA, have contributed significantly in this regard. However, rights and choices is still difficult for many women in Nepal. The girl in the video, as you had seen, wanted to be a nurse, but due to financial constraints, her father could not pursue her studies and preferred that she get married. Even when she's relating that story, you can see tears in her eyes. So such unfulfilled desires of education, which I also saw in your Philippine sector. I think there were a lot of similarities of unfulfilled desire for future education. I think this video represents that as well. Many parents still think that daughters are burden, they are others' property, and the quicker you get them married, the better. In fact, globally, Nepal has one of the highest rates of child marriage. 4 in 10 Nepalese girls are married before the age of 18, though the legal age of marriage is 20 years for both sexes. Nepal is among the very few countries in the Asia Pacific to have a standalone law on Safe Motherhood and Reproductive Health Rights Act since 2018. This is quite exemplary. However, in spite of health policies and plans implemented over the last decade, gains made in advancing sexual and reproductive health and rights in Nepal have been uneven and disparities exist. UNFPA report has indicated that only 48% of women aged 15 to 49 years in the country can make their own decisions regarding healthcare, contraception, and sex with their husbands or partners. Where services are available, social norms prevent women and adolescent girls from accessing them. Nepal is also one of the countries in South Asia that has the highest rate of son preference due to patriarchal culture and societal pressure. Many women do not have a choice in the number of children they have to bear until they get a son. Now, going back to the video, remember she has a son and a daughter. Now, I wonder if she had 2 daughters, wouldn't she be pressured to continue to have children until she got a son? Would her negotiating power have been strong? Would she be able to make a choice then? These are unanswered questions, which is still a reality in a society that still suppresses the voice of women and girls. But what was clear from the video is that information and services at any cost needs to reach the most vulnerable and marginalized in the medium and language they understand. To maintain good sexual and reproductive health, women and girls must have access to accurate information and safe, effective, affordable, and acceptable contraception method of their choice. And when they decide to have children, women must have access to services that can help them have a safe pregnancy, safe delivery, and healthy baby. I think that's what the video was showing both the positive sides of continuing progress, but as well as the grim side of persistent challenges the hindrances in women's ability to exercise their choices and rights. Over to you, Leila.
Yeah. Thank you so much, Bandana. Thank you for reminding us that women and girls need to have necessary information to make the choices and have a right to make the choices for their life and future. Thank you for that. So now I want to conclude our interview by asking you about your views through your role on the CEDAW committee, knowing that leaving no one behind is the vision of the Sustainable Development Goals. From your perspective, what is the prognosis for Nepal going forward? And what are the linkages between what you see in Nepal and globally?
Well, I think the pandemic has had an unprecedented impact globally. And as we have already seen, particularly in countries from the South, and countries like Nepal, Philippines, from the Asia-Pacific region. But if you take the case of Nepal, for example, despite gradual improvement in women's sexual and reproductive health, the country's target to reduce maternal mortality to 125 per 100,000 births by 2020 has become unachievable due to the increased number of maternal deaths since the COVID-19 related lockdown was imposed. Many other countries like Nepal will face similar challenges. Sexual and reproductive health and rights are fundamental to people's health and survival, to inclusive and sustainable economic development, to the well-being of women and girls, and more broadly, communities and countries. Therefore, I see the role of CEDAW as the principal legal framework for assessing discrimination against women and girls to be very crucial in the coming days. It can strengthen the accountability of state parties in addressing the glaring gaps that has been brought forward, particularly in the sector of sexual and reproductive health and rights. CEDAW, in terms of its link with SDGs, CEDAW provides critical normative standards that are intrinsically linked to the Agenda 2030, such as those related to non-discrimination, political participation, education, health, housing, freedom of expression, you name it. The CEDAW committee places great importance in the progress achieved by state parties in implementing SDGs against these targets. The CEDAW committee also adopted a 9-point guidance note on COVID-19 to ensure that state parties take adequate measures to address the pandemic and its impact, direct and indirect impact on women. And one of the points is particularly related to sexual and reproductive health and rights, providing gender-responsive sexual and reproductive health services, including maternity care as part of their COVID-19 response. Now, based on this guidance note, the CEDAW committee will now examine all state parties' reports through a COVID lens. When we look at the link between ICPD vision and CEDAW, what I see is I was in Nairobi also. So the Nairobi Summit on ICPD 25, with more than 8,000 delegates from around the world, committed to accelerating action to reach the SDG target of the universal access to sexual and reproductive health by 2030. In the coming days, in alternative reports to CEDAW from NGOs, UN teams, and National Human Rights Institution, progress and challenges made in implementation of ICPD vision needs to be reflected more significantly in the context of the pandemic. And with the wide-ranging impact of COVID pandemic on human rights, women's rights to bodily autonomy must be protected to ensure that they can make choices about their bodies and future without any fear of violence. CEDAW committee can in its entire process of examining state party reports emphasize on safeguarding women's sexual and reproductive health and rights, greater investment in this area, required policies and legislations, putting women at the center, maintain continuity of healthcare services, and increasing women's rights and choices. This is so much linked to gender-based violence and discrimination and gender equality. And in ending, I would like to stress that CEDAW, with joint forces from other UN mechanisms, can contribute significantly in reducing social and cultural barriers that women face in exercising their reproductive choices and rights, which is the true vision of the ICPD program of action, and also in the absence of which we will not be able to succeed in meeting our SDG goals and targets. Thank you so much.
Thank you so much, Bandana, for these very powerful messages that you are sharing with us. I think that this is very, very important that you remind us that we have mechanisms like CEDAW or the commitments that we made in Nairobi so that we can ensure that women can stand up and claim their rights and choices. Thank you, Bandana. Thank you so much. So now we have seen from the stories of the Philippines and Nepal how tenuous the status of women remains in communities and societies at large, and how much further we have to go in achieving generation equality, not only at this time of COVID-19, but well beyond. The same principles applies to the rights and choices of various vulnerable and underserved populations, including persons with disabilities, whose sexual and reproductive health and rights are too often ignored. To explore this issue, we turn to the final segment on our World Population Day observance, a special look at the situation in Thailand, beginning with a story of one young woman living with disabilities who demands that her voice be heard. So let's watch this story of this one young woman from Thailand.
ก็ตั้งแต่เด็กจนโตมาค่ะว่าร่างกายของเราเนี่ยจะต้องเปลี่ยนแปลงไปมากขึ้นอะไรอย่างเงี้ยตอนที่หนูอยู่ม.3 อย่างเงี้ยค่ะว่าถ้ามีประจำเดือนขึ้นมาเนี่ยเราจะดูแลตัวเองยังไงแล้วถ้ามีหน้าอกที่มันขยายขึ้นมาเนี่ยเราจะมีการแบบจัดการยังไงหาข้อมูลนะคะเรียนด้วยแล้วก็หาข้อมูลจากพี่ๆที่เขามีประสบการณ์ทางแพทย์ด้วยอยากให้เข้าถึงตรงนี้ว่าถ้าเขามาปรึกษาคุณในเรื่องของเด็กพิการคนหนึ่งโตขึ้นไปเขาจะมีลูกได้ไหมเขาจะมีลูกยังไงคุณหมอจะมีวิธีรับมือกับคนพิการที่เขาท้องยังไงถ้ายิ่งห้ามก็เหมือนยิ่งยุเหมือนวัยรุ่นทั่วไปเลยก็คือมีอารมณ์เหมือนกันห้ามไปอยากรู้จังเลยว่าสิ่งที่ห้ามเนี่ยมันเป็นยังไงอย่างเงี้ยค่ะเขาก็จะยิ่งทำพอยิ่งทำปุ๊บทางผู้ปกครองเองเนี่ยไม่มีคำแนะนำให้เขาสิ่งที่เขาเป็นต่อไปก็คือเขาพลาดจะมาโทษว่ามันคือบทเรียนของพวกเราไม่ได้มันก็คือบทเรียนของพวกคุณด้วยเหมือนกันคือบทเรียนของประเทศชาติด้วยเพลงจะเป็นคนที่พ่อแม่เนี่ยเปิดรับด้วยในส่วนตรงนี้พ่อแม่จะไม่ปิดกั้นไม่ว่าเราพิการหรือว่าเราเป็นยังไงเนี่ยสิ่งหนึ่งที่พ่อแม่เข้าใจเราเลยคือความรู้สึก
What a remarkable young lady. She's one of many in Thailand whose issues are gaining increasing attention, thanks to advocates and parliamentarians like Senator Montian Buntan, who joins us now from Bangkok. He has served as a senator of the upper house of the Royal Thai Parliament since 2008. He is a globally renowned advocate, serving on the Committee on the Rights of Persons with Disabilities, the Thailand Association of the Blind, and the World Blind Union. Senator Buntan has contributed to the development of the United Nations Convention on the Rights of Persons with Disabilities, the first thematic international human rights law for persons with disabilities, and the first international human rights treaty for the 21st century. Senator Buntan, welcome.
Thank you very much, and a very good afternoon to you all. Many thanks to UNFPA for including me in such a historic event on this World Population Day.
Thank you, Senator. Senator, we just heard the story of one young woman who insists that the sexual and reproductive health and rights of persons with disabilities be a priority. From your perspective and through your own story, how far has Thailand come in achieving this? What have been the challenges, and how are you and others working to bring about change? Over to you, Senator.
Thank you very much. I think Thailand has been coming quite far from where we were known traditionally, because in the long past, this sexual and reproductive health and rights is not a subject to be discussed in an open society or in the public. It is considered a very peculiar subject to be discussed. But some decades ago, I think we have progress with population and family planning, and in general, Thailand has been too successful in this area to have birth control on track, that we are now becoming aging society immaturely, I would say, because we have so low rate of birth. But such progress may not be reflected in some particular groups of population, so-called vulnerable groups. I would say there are a lot of voices unheard. In this case, the voice of persons with disabilities, mainly women, girls, LGBTQ+, and ethnic minorities with disabilities. These people are living with, I would say, double or multiple forms, intersectional form of discrimination, negligence, isolation. So in many cases, they are not even recognized as sexual beings. So I would say, even though the mainstream society has been going quite far, if you look into detail and trying to understand the situation of certain groups of people, they are still far from having full access to sexual and reproductive health services, and their rights not recognized fully. Can you hear me?
Yes, now I can hear you very well. Yeah, you are really making a point, but it's really very important to focus on the rights of the most vulnerable and the left behind, no? So thank you for that, Senator.
Yes, but I think a good example that we saw from the video has shown the reality, the new reality, that those who are considered minority groups or vulnerable groups, especially the voice from the video, young woman with disability, it shows that people are willing to stand up and to voice their concerns and to demand that their voice be heard. You are going to see such examples from many communities. Of course, such voices may be considered too far out from what they're expected to do or to perform. But I think the voices are getting louder especially after we've had the law to protect the rights of persons with disabilities. We also have the law on gender equality and the law to prevent domestic violence against women and children. And also, the most recently, the law on teen pregnancy. So all of these, I think, have put the society under great alarm that the society at large could no longer neglect problems that tend to be under the carpet in the past, and we need to recognize that such problems do exist, and the problems need to be put on the table and resolved in the inclusive and democratic manner.
Yeah, thank you so much, Senator, to remind us how important to have a legislation that protects the rights and the sexual reproductive health and rights of the most left behind. So now, if you allow me, let's focus on the impact of COVID-19. The past year and more of COVID-19 has had a significant socioeconomic impact in Thailand. How have the rights of persons with disability been affected in your views?
Well, if I were to look into how much effort healthcare workers, volunteers, professionals been trying to address the issue and try to do their best job, I think I could give them A+. These people have been working so hard. Especially the primary healthcare volunteers, or some people may say village healthcare volunteers, have been working so hard. Our doctors and nurses and paramedical professionals have been working so hard, and we were so successful in the beginning. But now I think we're at the same page, at the same stage as many countries, that we are suffering a big skyrocket number of a pandemic, the outbreak and the huge expansion. Persons with disabilities have been, to some extent, set aside when it comes to disability-specific rights. Of course, COVID-19 treatments, we were able to address the issue. We were able to make sure that persons with disabilities have access to basic health care, and even disability-specific field hospital was established a few weeks ago, especially in the Bangkok and metropolitan area, where there are a lot of migrant workers with disabilities. Some diagnoses have been made, and they have been handled to some extent. But I would say, because much effort has been very much put upon the pandemic itself, the specific needs of certain population groups may be a bit overlooked. And in this case, there are a lot of severely disabled people who are paralyzed, people who belong to stateless or migrant workers. Some of them with severe disabilities may not have access to such healthcare services. Now, when we're talking about sexual reproductive health and rights, there are a few cases that some hospitals have to close down the section on delivering child because many nurses were infected with COVID-19. So you can imagine how even the general public may not be able to have access to reproductive healthcare services under this situation where a majority of efforts have been made to handle the pandemic. For persons with disabilities, it could be worse because even the pandemic itself, where there is something related to disability requirements, they could be overlooked. Persons with disabilities cannot have access to vaccination easily. Some of them who are at home, paralyzed. Some of them do not even have to go out to work because they are paralyzed at home. And they could be infected through their family members. And there's no way for them to get easy access to medical health care. That doesn't mean that the health workers do not try to make effort. That doesn't mean that the government has not tried. But the fact that the management of COVID-19 pandemic already is overwhelming. And it takes away their time and energy and resources from looking into specific needs and requirements of certain population groups. So I think this is going to cause the needs and requirements of persons with disabilities to be, to some extent, overlooked and unintentionally neglected.
Yeah, thank you so much, Senator, to absolutely to share with us that the COVID-19, of course, affected the population, but more the people with disabilities and other marginalized and vulnerable people. So perhaps very quickly, the last question that I want, to ask you is about the SDG vision, which is, leaving no one behind, no? And so what do you see as the way forward for Thailand in achieving this, including, of course, for persons with disabilities and other communities and population who have faced so many challenges to achieve, the SDGs? So can you please share with us your views on that?
Well, I think my view has been probably not of my own only. I think it has been shared over and over again by many activists, many human rights advocates, many social development advocates. I think we need to see more community-based services, community-based development in an inclusive manner. We want to see inclusion. We want to see participation. We would like to see more empowerment model of development, including in the health issue. The pandemic has proven to ourselves that we cannot afford to put everyone in the large hospitals. We cannot use the traditional, conventional, existing institutions to take care of everyone. We need to empower the community and the people to help themselves and to collaborate with the government. We use the term deinstitutionalization in the CRPD language. We also use a lot of community services, community inclusion. But we also need to make sure that the movement that will strengthen such future or that will strengthen the possible trend towards that model of development as suggested by SDG is to empower the people to form movement, to be well organized, and to strengthen one another, both individual target groups and in across different civil society movement. We need to encourage strengthening of civil society. So I think this is almost the only way to help bring about a possible success to the SDGs, because the traditional governance system of each country is just not enough. It is so rigid. It is like a silo base. It cannot work across different ministries, different departments, different sectors. So we need to have strong people sector. That's why I've been advocating for this approach, is to strengthen people together, form organizations, work across different sector as movement under the name civil society. And we need to see more services be established, be made available at the community level rather than at the institutional level. Thank you.
Thank you so much, Senator, for sharing with us your views this afternoon and for the incredible work. Thank you so much. Thank you so much. So, and with those inspiring thoughts shared by Senator Montian Buntan of Thailand, we are near the end of our World Population Day commemoration with one clear message that emerges from all the stories that we have heard today. Sexual and reproductive health and rights for all, grounded in gender equality and human rights, must be at the center of all population policies and approaches everywhere. So, and now let us turn to our regional director once again for his final thoughts upon listening to all of our speakers and stories shared today. Björn, the floor is yours.
Thank you so much, Leila. No, it has been a fantastic webinar and with so many different thoughts and encouragement to move forward and to make sure that sexual and reproductive health and rights really becomes universal to everyone wherever we are. And I think the different stories shows us also that we need to see the individual and to be able to reach out to individual men, women, young people, to cater to the needs, because wherever you are in societies and wherever you're coming from, you have special thoughts and special needs in this area. And I think the conversations we have had today really convinced me further to the importance of that we, as whether we are working in international organization, representing government in different fora or wherever we are, we need to remind ourselves that it's an individual behind all of these issues. And I think also linking this to what was adopted in 1994 in the Cairo conference, that we moved from numbers, population growth, issues around the demographics, to understand the rights and needs of individuals. Yes, of course, today we see many governments and countries are discussing population growth or a pronatalist policy. But again, like I said in my opening remarks, it is so important that we remember that each and every one of us must have rights and choices when it comes to sexual and reproductive health. And also that we continuously work and never give up the ambition to achieve gender equality and really find the positive in all of these aspects so that we can have both men and women, boys and girls are equal in our societies and have equal access to services, information and care. So with that, Leila, with further ado, thank you so much all of the participants. And thank you, Leila, also for taking us through this day, which has been most rewarding. So back to you.
Thank you so much, Björn. And a big thank to you, our audience, for having invested over an hour now of your time today as we mark World Population Day 2021. Join UNFPA going forward to achieve the 3 zeros, the zero unmet need for family planning, the zero maternal death, and the zero gender-based violence and harmful practices against women and girls. UNFPA transformative results in a world where every pregnancy is wanted, every childbirth is safe, and every young person potential is fulfilled. Thank you so much. Stay safe, stay well, and we will be in touch.